Hey guys, Rob from AST here. So I wanted to take a moment and give you guys an abridged version of a presentation I've been giving across Southern California. For the last 3-4 weeks, I've been all over Southern California giving presentations like this one about the new California insurance mandate to help prepare families, professionals, regional centers for this incoming change and what it's going to mean for children with autism with regards to their ABA services. I know just because I say Thursday night at West Covina, I'm going to be there, doesn't mean you can be there. So I wanted to give you guys an update of some of this presentation, how it might affect you, and give you some information to get the process started if you're not quite sure where to start. So let's look at SB 946 for a second. SB 946 is the actual name of the California insurance mandate to provide ABA services to children with autism. And if you actually look at the bill, it gives you a really great summary statement here, which says it requires every healthcare plan that provides hospital, medical, or surgical coverage to also provide coverage for ABA and other evidence-based behavior intervention programs for pervasive developmental disorder or autism. So at first glance, this sounds fantastic. That means every single insurance plan needs to cover ABA. Unfortunately, that's not the case. There are some exceptions to this law and to this passage as you go deeper into the bill. So here are the key exceptions you need to be aware of. First, your plan needs to cover mental health or behavioral health. If you don't have those in your medical insurance, ABA would not be covered. That's because ABA is always going to fall underneath the mental health or behavioral health part of any insurance plan. The second group of exceptions are going to be state-funded health insurance. Now this gets really complicated. We know for a fact anyone with Medi-Cal is not going to cover ABA. They are excluded from this mandate. It's clearly stated in the bill. Where it gets a little tricky is with Healthy Families and CalPERS. Those state plans, some of them are actually covering ABA and some of them are not. It's a little unclear based upon SB 946 whether or not they're supposed to. So the best thing to do in that case is to speak to your insurance company directly and confirm whether or not you have coverage. The last group to be aware of is that this bill applies to fully funded plans. Now, fully funded isn't something you're going to find on your insurance card. It's something that you're going to need to talk to your HR department or you're going to need to talk to your insurance company about to find out, do I have a fully funded plan or a self-funded plan? Now, 60% of people with private insurance in California actually have fully funded plans. So if you go to your HR department and ask them, what kind of insurance plan do we have? Is it fully or self-funded? That's going to give you a lot of insight into whether or not this bill is going to apply to you. So let's look at the actual type of coverage you're going to get and what kind of ABA services you can expect from the bill. What's really great about this bill is that it actually is going to allow for a greater number of goals and domains to be covered by an ABA program as compared to the regional center. Every year, the regional centers have been seeing greater cuts to what they do. If you look at every trailer bill, there's some language in there about different services or different things that they're not allowed to cover. And we've seen, particularly in some areas, some cuts to social skills, as well as to some of the communication goals that regional centers will fund. In the insurance landscape, you don't have those same restrictions. Essentially, the only thing the mandate says that the insurance company doesn't cover is respite, daycare, and academics. So from an ABA program's perspective, the only thing we can't cover is academics. So all of these domains here, social skills, communication, behavior, self-reg, independent living skills, independence, parent training, all of that can be covered by insurance. And it's because of a concept of medical necessity. We're now moving to a model of medical necessity versus a regional center system where it's more of a developmental or therapeutic model. The best way that I like to define medical necessity is treating the core deficits of autism. And if goals are about treating those core deficits, then you have a medically appropriate or medical necessity for the goal. And that's a core element when it comes to where services can take place. Because if you think about medical necessity, you can't have something be medically necessary in one environment and not the other. The analogy I really like to think of is someone who has diabetes. And if I need to take insulin to treat my diabetes, I wouldn't only take insulin at home. and nowhere else. I may need to have my insulin with me at work, or at the mall, or in the car, or at the park, everywhere, because it's not a matter of my environment that dictates when I may need to take care of my medical needs. The same thing is true when it comes to kids with autism and ABA. So if a goal is deemed medically necessary, if a child has core deficits in the social realm, and social skill goals have been deemed medically necessary to treat those deficits, I then think about what environment is it appropriate for me to target social skills. So what does that mean? Services can be provided essentially anywhere. The home, at a clinic, in the community, at a YMCA or a park. We've seen some kids been able to get approved for services at a summer camp, and it can take place at a school setting as well. Now the big thing to keep in mind, just because a service is approved and the insurance company is fine with services taking place at other environments, whoever runs that environment needs to approve having ABA there. Just because I can provide services at a summer camp from the insurance company's perspective, the camp director needs to say, yes, Rob, come on in. We want you to target these social skill goals with that child. The same thing is true with any other setting, such as a school, such as at the YMCA, at a daycare. So you need to keep that in mind when you think about where your services will take place. So let's look at the qualification. One of the things that I've noticed is that over the years we've had a stricter definition with the regional centers as to who qualifies for ABA services through the regional center. With this mandate, we're actually looking at the entire autism spectrum. Any child on any end of the spectrum is eligible for ABA. So you could have a diagnosis of autism. You could have a diagnosis of PDD-NOS, Asperger's. We've seen kids with Rett's and Angelman syndrome approved. So they're looking at the entire spectrum, not just specific parts of the spectrum. Also, there's no age limit. So kids of all ages, and even adults, can be approved for ABA services if they're deemed medically necessary. This is a huge change because anyone with a child on the spectrum who is in their teenage years or in their young adult years knows the number of opportunities and services out there are a great deal more limited than for children who are in early intervention or in preschool. So let's talk about how much is actually covered. This bill has no caps. If you look at some of the other states, you'll see maybe a dollar amount cap. You'll see maybe $36,000 a year of coverage. California, there is no limits. So you don't have a limit to how many dollars can be spent, how many hours can be provided. There's no limit to the number of visits, no annual caps, no lifetime caps. It all comes down to medical necessity. And the authors of the bill did this on purpose. That was their vision. So let's talk a little bit about the approval process. Some of you guys may have seen some of the blogs I've posted where we talk about the core things you need. And they're the same three things I talk about. You need to make sure that you have your insurance information, so your member ID number, your group ID number, that core insurance information that's on your insurance card. And you need a formal diagnosis from a licensed professional, a psychiatrist, a pediatrician, a neurologist, a clinical psychologist. And in that diagnosis, they need to clearly state that your child has autism, give the official diagnosis there, and if possible, it would be great if they can also recommend ABA. It gives you a little bit of extra oomph when you're trying to make a case with the insurance company. Now, some feedback we've received recently is that the insurance companies are asking for reports that are from the last 5 years. If you have something that's 7 years old, you may want to go talk to someone about getting a reevaluation or having an addendum written into the report to give an update to say, this child still qualifies, he still has a diagnosis of autism, here's what I see. I've seen a lot of families do that who have reports that are maybe 10 years old. They'll have a brief follow-up report to give an update to that initial report. Then the last thing you're going to need is you need a treatment plan.